Hello and welcome. My name is Brian Hutton, and today I'll be going over my presentation on CPR resuscitation. So the first thing I wanted to cover is the TV idea of CPR. CPR, in the eyes of the consumer world, is very idealistic. Um, they most often think of TV doctors rushing into a room and performing CPR frantically, and eventually the patient comes to. There are a few things wrong with this idea. The first being that, one, a lot of times these doctors aren't actually performing at a proper rate of compression, and the other is that oftentimes they portray CPR as being highly successful. And the reality of the situation, unfortunately, is that it is not. The consumer idea of CPR has somewhat bred a lot of misinformation regarding CPR, how it works, and the proper steps and proper implementation of these things. So what misinformation is out there? The first would be how successful CPR is. On average, CPR is only successful at resuscitating an individual about 15% of the time. That's unfortunately rather low. The most optimistic records or statistics on the subject show that places like Seattle on average in the UK are about 30%. What steps are expected of civilians are oftentimes very misconstrued as well. Firstly, being that civilians are not actually expected to perform what's called rescue breaths and are encouraged to perform compression-only CPR, and we'll get into why that is a little bit later. Another thing is what to expect during and after. During CPR, the patient's chest will make cracking sounds. This is often because the ribs can oftentimes become broken, and along with the fact that a lot of cartilage is being ruptured in that area. Another thing is that the patient's going to be in a lot of pain and kind of come out in a daze whenever they actually are successfully resuscitated. Another big thing that's been misconstrued is when to actually notify 911. A lot of people believe that the first step, if you find someone unconscious, is to call 911, and that's not true. If you find someone unconscious who is pulseless, you should actually begin CPR first and call 911 after you've done 5 cycles of CPR, which roughly comes out to about 150 compressions. So why is CPR so important? Well, according to the CDC, heart disease is a leading cause, if not the leading cause of death for almost every age group. And I'll get to a chart showing some of these statistics in a moment. Early quality CPR is considered the most important factor in determining the outcome of a patient suffering from a heart attack or heart-related incidents. Which means that the people who are around this individual, not necessarily EMS providers or the hospital, are going to be the most important factor in determining whether that person makes it out of that event. And the more people who are able to help perform in what's called the chain of survival have a higher chance that that patient will survive the event. And we'll get into what the chain of event or the chain of survival is in just a moment. So this is a chart from the CDC showing some of the statistics on what the most likely cause of death is for every age group. And you can see that heart disease, which in general is just understood to kind of mean heart-related complications, is in the top 5 for almost every age group except for one. And in that one, which is 10 to 14 years old, heart disease is number 6. So what happens to the body when CPR is delayed? Well, within 1 minute, there's cardiac irritability, which is to be expected considering that it's a heart-related complication. In roughly about 4 minutes, brain damage isn't likely, but it typically begins around that time period. And in 4 to 6 minutes, brain damage is to be expected and is highly possible. This is due to the fact that circulation hasn't been bringing both oxygen and glucose to the brain. And within 6 to 10 minutes, brain damage is almost an indefinite fact. And at that point, the person is going to have an altered life from that point on. And at more than 10 minutes, brain damage is completely irreversible, and that person will be altered for the rest of their life. Which is why early implementation of CPR is so important, because with a delay in care, there are significant decreases in the chance of survival. So what improves outcomes? Well, first is following the chain of survival. The chain of survival is first recognizing that there is an event happening and beginning to implement further steps needed. Second, if you witness the event actually happen, call 911. If you find the person unconscious but you don't witness them actually collapse or have any complications, then begin CPR first. Third is CPR. Actually beginning high quality CPR at the proper depth and rate of compression is incredibly important. Last is certification and training. The more people who are certified and trained and have experience in basic life support when it comes to heart-related complications are some of the best ways to improve overall survival rate across the country. And new training these days includes the use of AEDs or automated external defibrillators, which wasn't included in previous training. And lastly is being more than an onlooker. Playing an active role can make all the difference in determining whether a person lives or dies, which means that the public in general plays a bigger role in determining whether a person survives an event than anybody else does, not EMS or the hospital. Thank you for listening so much.